Hey everyone, back with another edition of Dr. Twyman's Ask Me Anything, where I help you prevent your risk of having a heart attack or stroke. That's what I specialize in. I'm a board certified cardiologist. I started Apollo Cardiology back in the summer of 2019. Can't believe it's been 5.5 years. Time is absolutely flying, but now I just focus on proactive preventive cardiology, and I try to lead by example when I can. So in my story you saw, I was getting an updated carotid intimal medial thickness scan, CIMT. That's the scan that tells you your vascular age, as well as do you have any plaque in your carotid arteries. Well, I've never had plaque in my arteries. I have had some thickness in the carotid, particularly on the left side in the past, mostly when I was still in the cath lab as an invasive cardiologist. It's because the radiation source was on the left side, and I think the radiation caused the carotid to get inflamed. And when I stepped out of the cath lab and stopped treating heart attacks and decided to focus more on preventing them, that intimal thickness had ultimately improved. I have a device called the Butterfly. It's a portable ultrasound that plugs into your iPhone. It's a pretty cool, slick piece of technology. But there's some new software we were able to do a CIMT with it, so we were testing it out on Friday, where Dow, who's part of our team, was doing a scan with that and our standard CIMT, and we're going to compare to see what the differences is. So once those results are back, I'll share them in my stories here. But this weekend was, a weekend of mostly just recovering. A couple weeks ago, didn't have this voice, so finally got my voice back the other week, and so have been doing a lot of errands, getting caught up on some things. I'm going to be heading out to Japan in a few weeks, so getting all the gear I need for that trip, and doing a lot of relaxation. So you saw my story where I was doing Isofloat this weekend. I've been doing floats off and on for the past, 6-7 years, I think. Awesome way to relax. I think there's a question later about insomnia. I'd highly encourage you to try that if you haven't yet. Almost everybody who's tried one of those notices that their sleep quality improves. And I'll talk a little bit more about that when I get to your question. So we'll jump into the questions. I'm usually going to stay live for up to 30 minutes if questions keep rolling in. Otherwise, I'll cut it when the comments are done, and I'll come back next Monday, 6 p.m. Central Time to answer the questions. So here we go. First question up tonight: do the fitness devices like the Oura Ring have side effects? The short answer is potentially. I am wearing an Oura Ring at this moment, so it is best done on your left hand on the pointer finger, your second digit. And I've had an Oura Ring since the original ones got off the Kickstarter many years ago. I think it's been 8 years since I've had an Oura Ring. The first gym was very large, looked like a mood ring, and then they've progressively gotten smaller and smaller, lighter and lighter. But I've always been a little bit concerned about the EMFs that come off these devices. So I personally don't wear devices if there is not a Bluetooth off mode or airplane mode. So I keep this ring in airplane mode all the time. And when I want the data, I take it off my finger, I drop it on the charger, go into the app and download my data, put it back in airplane mode, put it back on my finger. So when you are in airplane mode, I'm not as concerned about it. So I don't really utilize anything else other than that. I did show my story, the Aktiia device that measures 24-hour blood pressures. At this time, it's not FDA approved, and I had a kind patient get one from overseas for me to play around with, and it is relatively accurate on my blood pressure. But one thing I don't particularly like about this device is that there's not a airplane mode for it. So it's something that I'm probably not going to be playing around with long term with myself until they turn that feature on. Question I have, I believe this is Microvascular Disease, MVD. What test is done to see if I have it in my brain? Has been experiencing headaches. Your vascular system, if you're low nitric oxide in one vascular bed, it's very likely you have it low in others. So I would start literally head to toe. Look at salivary nitrite test strips. Those are the ones that you put on your saliva. If they're white, okay, you don't make salivary nitrates very well, and probably are going to be low in that way to make nitric oxide. I would look at your blood pressure. Should be less than 120/80. If you have access to something that can measure your central blood pressure, that also should be less than 120/80. Pulse wave velocity, there's also things called the max pulse. The Oura Ring has a cardio age, which is basically looking at arterial elasticity or stiffness of the arteries. That should be normal. And then the Endopat. The Endopat is the reactive hyperemia test that I perform in my office. It's basically a stress test for your arteries and tells you how much nitric oxide your arteries can release when you have reactive hyperemia. So in English, that's when blood flows across your arteries. Nitric oxide gets released. So this is one of the reasons why exercise is so protective for the cardiovascular systems, because more nitric oxide gets released as you increase the blood flow across the arteries. So those would be the starting points. You can look at blood work, asymmetric dimethylarginine, uric acid, homocysteine, urine microalbumin creatinine. Those would be some starting points. But as far as I know, I wouldn't think that there's any test that you could do on your head exactly that would tell you, do you have microvascular disease from endothelial dysfunction there? You potentially could do an MRA, but that would just be looking for fixed stenosis. It would not confirm microvascular disease. Next question of tonight is about statin therapy. Do the statins lower inflammation? The answer is yes. The lab that you can follow is hs-CRP. That was shown in the Jupiter trial. Patients who lowered their hs-CRP had less cardiovascular events. And does it heal the endothelial lining? Potentially, yes. The Glycocalyx, which lines the endothelium. There have been studies, particularly with rosuvastatin, that it increases the volume of the endothelial Glycocalyx. Are grounding sheets or mats effective, and how is their effectiveness measured? Both great questions. Are they effective? It depends. How are they being grounded? Optimally, you have a wire that's attached to the mat or the sheet, and it is going out your window or door and going into a copper plug that's into the actual ground. I do not like it when these things are plugged into the walls. I don't really care if they come with the little plug detectors that say your lines are grounded. It doesn't mean that you're not going to be potentially attracting dirty electricity to yourself. So I don't personally plug things into the walls and ground with them. I only have bare feet or grounding shoes outside. I'm not currently using any grounding technology inside. And how is their effectiveness measured? That's a great question. Things you can look at is your heart rate variability better on any of your trackers? Is your oxidative stress and inflammatory markers lower in biomarkers? Do you subjectively feel better, more energy? Because that's how you're going to know that is potentially beneficial. But I can tell you, when I tried these things and plugged them into the walls, I would always have nightmares, and it would cause me to be severely nauseated. So no benefit for me plugging the stuff indoors. That may just be my N of one, maybe where my place is located in St. Louis, but it also happened in my office at Apollo Cardiology. So I think it is, at least I'm not, just having an N of one experience at one location. Both times I tried it at different locations, I had the same response. So it does not work for me if I plug these things into the wall. Are omega-3 supplements beneficial or safe? Do I recommend them on occasion? Yes. Do I prefer them? No. I want people to eat real foods. That's how Mother Nature intended it. Can they increase the risk of bleeding? Potentially, but I've seen literature that really only happens when you get up to 20 grams or 20,000 milligrams, which is usually at least 5 times higher than what most people would take as an upper limit supplement dose. Generally supplementing it 2 grams a day is usually the benefit ratio is pretty safe. But the question is, do the omega-3s have other things in them? Possibly. So you want to stick to good nutraceutical brands. And there's always a debate. Do these things actually get into the cells if it comes from a supplement? Unknown. It's, quantum physics. Are these things in the SN2 position? The triglyceride backbone has 3 fatty acids. You need it to be the middle fatty acid to get into the brain. Unknown if the supplements can do that. And then here's the sleep question. So tips for insomnia. The person says they tried the sunset, no eating 3 hours, no phone or PC, got fresh air, same bedtime. Okay, so let's start with optimizing sleep hygiene. You're hitting a lot of good points. Sunset's good, but you have to see sunrise. There is no replacement for seeing the sunrise if your sleep is not optimized. You want to get your suprachiasmatic nucleus dialed into day and night. So bright light early in the morning from the sun. How much time? As much as you can get. If you're sleeping well, maybe you need less. Then when you're inside, limit your artificial light. Use natural light. Keep windows open. If you must use lights, protect your eyes. So yellow tinted blue blockers during the day when you're inside, switch to the red ones post sunset. The red ones make you look like the Terminator, but they block 100% of blue light, 100% of green light, and basically tell your brain it is midnight. So personally, I can't wear these things more than half an hour to hour before I'm absolutely unconscious. Good, you're seeing the sunset, you can do that. That's a good kind of frame that, okay, no more blue lights coming in the eye, so should be red light or darkness after that point. Stop eating at least 3 hours before you go to bed, but more may be better, so try 4 hours before you go to bed. If you're drinking caffeine, keep it to before 10 a.m. Do not drink any alcohol if your sleep is not dialed in. Good. Limit your technology use at night. It's not just the blue light from the device, it's the content. So if it's something very engaging, it's irritating you, it's something in the news that you don't like, don't look at it at least an hour before bed. Do something more relaxing. If you're somebody who prays, great, do it in the evening time, or meditate, or deep breathing exercises. I like heart math. Heart math is biofeedback. 10 minutes a night helps many people. Wearables, the Apollo Neuro has some data behind it. It vibrates at different frequencies and can help balance the autonomic nervous system. If you have access to a sauna, using a sauna in the early evening time, that heat increase and then dropping temperature helps. Same thing with cold plunge. There's different reasons at different times of day to use it, but for sleep, if using in the evening time may help. The colder you are, oftentimes the better your sleep quality will be. And then, your EMF exposure. Your bedroom should be dark, quiet, cold, no Wi-Fi. Keep your technology out of the room. It should be a dark cave where you're going to bed. That's time to go to bed. And keep the wake-up time the exact same, 7 days a week. Your bedtime can shift a little bit if you're not that tired, but the wake-up time should be exactly the same 7 days a week. Start there. There are times and places that supplements may be beneficial. So when I travel, particularly going to Asia, yes, I'm going to take some different supplements to try to help tell my brain it's nighttime, where I'm going to try to go to sleep. So magnesium, L-theanine, glycine, probably some phosphoserine may be utilized as well. So, insomnia, those are my best tips that I got so far. All right. So, seeing some questions popping up. So, which is better for my health, infrared sauna or red light therapy? It's basically, is AM radio good or is FM radio good? They're both good, different use cases. If both are good, is it okay to do them in the same day? Yes, but you don't want to use them at the same time. So there is some slight overlap with some of the infrared frequencies, but generally think as photobiomodulation, or colloquially red light therapy, is something utilized to stimulate mitochondria energy flow. The red light penetrates into the mitochondria. The 4-cytochrome knocks out nitric oxide. Nitric oxide diffuses, can dilate arteries. But when you knock out nitric oxide from the mitochondria, it then releases the handbrake, allowing essentially the electrons to flow through the mitochondria and energy flow to continue. Also helps lower inflammation, increases blood flow, decreases pain. Now for the infrared sauna, that is important because it's helping structure the water in the body. So your Glycocalyx is heavily sulfated and water dense. It's structured water or easy water, or preferably coherent domains. Pretty much the same terminology. The infrared is what's charging up the water inside the cells. It's also good at helping detoxify from different plastics, heavy metals, but it's also something that's going to increase your heart rate as that heat is getting absorbed. So it's basically simulating exercise. So there's some overlap, and yes, you can do them both in the same day. You generally probably would do the red light therapy first and then sauna. Next question is 15 or 30 milligram raises in my blood pressure means I don't need to supplement it. I don't know what that means. So typically your blood pressure should be 120/80 all day long. If you saw on my 24-hour blood pressure monitor I've worn for the past week, my blood pressure was always under 120/80. And then your blood pressure should dip in the evening time, generally at least 10% while you're sleeping. If your blood pressure is increasing, depends on what time of day. It's normal that it increases a little bit early in the morning, but if you're having these surges of blood pressure, depends on where the surges go up to. If you're persistently over 140/90, you always want to look at things in your environment that are potentially increasing it. But if you can't control your blood pressure, then yes, you may need to replace certain nutrients. Sometimes certain supplements will help. You may want to optimize nitric oxide with supplementation, but if that's still not controlling it, then that's when you need to consider pharmaceuticals to keep the blood pressure controlled, because high blood pressure is the number one thing that's damaging the glycocalyx and the underlying endothelium. So I agree with this person. They said that their house ground is not safe. There's always some voltage and noise in it. It makes them sick in 1 to 2 minutes. You need to have a dedicated ground outside the house. Completely agree with that one. Seeing some familiar faces here tonight. So some people that are in the Dr. Twyman's tribe, or they come see us at Apollo Cardiology here in St. Louis. So. Question coming up. Definitely one that I'm not an expert in, but I'll give you my opinion on, is the cons and pros of chemical venous ablation. So before considering permanent treatments, you have to consider, have you done all the non-invasive ways to treat venous insufficiency first? So have you worn the compression stockings as high as you can tolerate? Can you keep your feet elevated more throughout the day? Have you tried, essentially less permanent solutions where, like living with it? That wouldn't be, coy with it, but like, unless it is severely painful or disfiguring, you may want to leave it alone. If you're going to do, ablation, you want to do it with somebody. This is their full-time job. This is not something that they do 1 day a week or 1 day a month. They do this all day long. You want somebody who has multiple options. Sometimes chemicals are the best option. Sometimes using thermal ablation is better. I never did these procedures. This wasn't my area of expertise, but I had colleagues in my prior groups that would do these things. And so you want somebody who, this is, like I said, literally their daytime job, so that they know the right venous reflex studies to do afterwards, and they put you through all the conservative paces first before suggesting a procedure that is irreversible and not without complications. There's always a risk of bleeding and infection, or if the vein doesn't completely close, you don't get the benefit. But if you don't have collateral drainage, you're still going to have pain and swelling in your legs. So it's something that I never did those procedures, and you need to ask the person that's doing the procedure a lot of the questions that I just brought up. Okay, so somebody's saying that if they take zinc and it raises the blood pressure, that means that they don't need to supplement it. Yeah, you don't want to take anything that your body is reacting negatively against. And zinc definitely can have an effect in some individuals. So I wouldn't take zinc unless you're confirmed deficient on a micronutrient testing with it. Now, somebody's doing it the right way, so they're watching this live outside grounding. So at some point I'm going to have to build an outside studio so I can do these things always outside. All right, guys, I think I did get through the questions tonight. So I appreciate them as always. I always enjoy doing these things. These questions are questions I get almost every day, some variation of it with my patients at Apollo Cardiology. So it's good practice for me to talk about these things with you guys, and then I can share the things that I'm learning along the way, because if I can teach it, then I can kind of implement it for myself. So I try to be a pretty good biohacker. I try to do almost all the things that I recommend to patients, personally, if I can, if there's a reason that I should do it. And then I teach you guys when I learn something new. So I don't have any new things other than my 24-hour blood pressure monitor, the Aktiia, at this moment to teach you guys. But if anything else pops up, I'll bring it back up with you guys. So I thank you as always for your time and attention. If you're interested in potentially working with us, if you haven't before, I do still have some availability this year, but I'm booking out 3 to 4 months into the future. Go to my website, drtwyman.com. If you apply, somebody from my team will set up an onboarding call with you and walk you through the process. So I do see that there's one more question, and I will answer that one. So, all right. So somebody says that they're listening to me each week all the way from Australia. That's awesome. I've actually had one couple fly from Sydney to come see us, and I've done some educational discussions with a couple people from Australia before. Question. If a bag of saline has 9 grams of salt, why do they apply it every time we're sick, since the max salt is 2 grams? So the max salt is not necessarily 2 grams. That is more kind of, a starting point for some people, particularly if they have heart failure, renal failure, difficult to control hypertension. Then they probably do need to be salt restricted on those occasions. But normal saline, it's going to have you holding on to water. It's going to raise blood pressure. So if somebody is sick and they're septic and their blood pressure is low, giving them salt holds on to water, raises their blood pressure back on. So, all right. And then I do see somebody asking about the Havanseen device. I'm going to have to do some research on that one again. And if I find out anything useful for it, I will let you know about that on my stories. So, all right, guys. Well, have a great week, and I'll see you next Monday, 6 p.m. Central Time.